with Shape of the City. I am at the state capitol with Glenn Parks. He is the coordinator for the Nebraska Human Trafficking Task Force.
That's correct, yeah.
Explain what is human trafficking for our viewers who may not fully understand what it is.
That's a great question because there is some confusion about this. Human trafficking, in the shortest definition, is modern day slavery. So it's compelling someone through force, fraud, or coercion to do something that they don't give their consent to do. This comes in two main categories. One is labor trafficking, in which you force someone to do what would maybe be a normal job, but against their will, and you don't pay them or things like this. And the other one that gets more headlines actually is sex trafficking, in which people are compelled against their will without their consent to engage in commercial sex or pornography. Now there's one exception to that last category. If someone is under 18 and they're involved in commercial sex, a commercial sex act, that is by definition sex trafficking because someone under 18 can't consent legally to a commercial sex act.
Now, I'm probably like a lot of people who have this hard time imagining it going on in their own community.
Yeah, exactly. Yeah.
So how did the task force get started? What was going on that got you guys going?
It's only been since 2000 that the United States has had laws against human trafficking labeled that way. And actually in Nebraska, it's only been against the law, there's only been a crime against it since 2006. So it is something kind of new that we're looking at. When Doug Peterson ran for the AG's office, one of the things he emphasized was he wanted to really ramp up our addressing human trafficking in all its forms here. And one of the main ways he's fulfilling that promise as the AG is through this human trafficking task force. So we got a federal grant to help start it, and it's intentionally multidisciplinary. So we work both with the law enforcement, which is more my focus, and also we've partnered with the services because, as you imagine, this is a crime that has living victims. I mean, the illegally owned substance is a human being. And so it's very important that law enforcement now work collaboratively with victim services. So the AG's office and the Salvation Army jointly applied for this grant, and we got it. So it's kind of co-led by the Salvation Army.
So let's talk a little bit more about what the task force does.
Okay, sure.
So what is your role? Who are the people you're partnering with across the state?
So I am the coordinator of the task force, and it's a very good title actually. It's quite accurate because I coordinate a lot of different entities. We kind of talk about it in three categories. There's law enforcement, there are service providers who work directly with the victims, and then there's community partners, which are lots of other NGOs and individuals that are helping out. And really each one of those is essential. We've organized, because the state's pretty large geographically and we can't meet often all together, we've divided the state into 5 regions, and so regionally, especially the law enforcement, with some services included, meets at least quarterly, and each of the regions are doing proactive operations, and so for those, of course, we meet more often and to plan those. So that's the law enforcement side. On the services side, the Salvation Army is organizing what services are available in each of these regions, so we have some contacts. So for instance, let's say there's a patrolman who pulls over someone for speeding at 3 in the morning. He's got 3 inappropriately dressed, unrelated 16-year-olds in the car, and it doesn't look like they're related. So maybe this officer separates them out and finds out, yes, this is actually sex trafficking going on. He knows what to do with the driver, right? This person who's probably, is at least alleged, a trafficker, but that patrolman might not know exactly what to do with these 3 16-year-olds in the middle of Nebraska. It's 3 in the morning. What do you do? So we are developing a kind of database and a network of people who could take those 3 girls that night, and then for the next week, and then maybe for the next year.
Wow, that's amazing.
Yeah, it's a lot of work, but it's fulfilling.
So you guys have a new campaign going on. Mm-hmm. Tell us a little bit about the campaign and how our viewers can be part of the solution. So
it's called Demand an End, and it actually started with, there's a group called Street Grace in Georgia, and they worked with the Attorney General in Georgia to develop this. And now there's, I think it's about 9 states and growing of groups that are organized to do this. So it's called Demand an End. It's a little play on words because we're demanding an end to human trafficking. That's kind of straightforward, but it's really focused on the demand side. So we want to end the demand for sex trafficking of minors. We in the task force look at the problem of sex trafficking as a market. People are doing this because they make money doing it, right? And if there were no one in Nebraska who would buy this, there would stop being people coming here to sell it, right? So it really is that. So we look at both sides, of course. We're enforcing the law against the traditional traffickers, the pimps, the people that force people into this. But we're also now, and with this campaign, really focusing and wanting to spread the word that we're looking at the demand side. The unicameral has recently given us two really big tools in this fight. One is last session, they raised the penalty on trafficking, labor and sex trafficking. So for instance, sex trafficking of a minor is what's called a Class 1B felony, which means the minimum penalty is 20 years to life. The second tool, which you put in combination with this, is they've included buyers along with the sellers as human traffickers. So this means that if someone in Nebraska decides that they either do or attempt to buy a minor for sex, they could be convicted for sex trafficking and spend 20 years or more, be sentenced to 20 years or more in prison. So what we really hope to do is to get the word out to Nebraska. Of course, sex is not something that should be bought or sold. Prostitution itself is illegal, of course. But we want those people, there are people that doesn't stop, right? There's people that still, it's illegal, they know maybe it's immoral, they're still gonna do it. We would like them to know that in addition to that, we are looking for you, and we're doing these operations to find people who are willing to do this, and we're going to prosecute them to the full extent of the law. The reason I appreciate the opportunity to come on your program to talk about this is because even though I work in the criminal bureau of the AG's office, our job is to prosecute. Our objective is safe communities, and I would much prefer to convince people not to ever even attempt or look to buy a minor for sex than for them to do that and then for us to catch them and prosecute them, right? So the more we can get the word out that there's a very high price to pay, not just morally, but now in the criminal system, I hope that will discourage more and more people from even looking into this.
Well, let's say a viewer is in their community, they see something suspicious. Maybe there's a house that they don't know what's going on,
right.
Or maybe they're just out and about. What should those people do?
That's exactly the right point. We are, a community of Nebraskans, and there are places that someone who has a utility, or a plumber or whatever, they might see things that the police would never be able to see, right? And so the first thing I would encourage people to do is learn the signs. Some of them are obvious. You think about, well, this is a sex trafficking victim. They're abused. They're being forced to do something they don't want to do. So there's some things you can imagine. Some things are not so obvious. So I would encourage them to go to the AG's website. There's a human trafficking page there that gives you some resources. But if they do see something that looks funny, and because they're a little informed about what this might look like, I encourage them to call. If it's an emergency, if someone's being dragged out by their hair or something, call 911, of course. But if it's a suspicion, a lot of times I'll mention, as an example, if there's a massage parlor in your neighborhood and it seems like only guys go there at night or something, that's maybe not worth calling 911, but I would very strongly encourage them to call the hotline. It's a national hotline. The number is 888-3737-888. And if they call that number and tell them the person that they're in Nebraska, they'll be put in contact with Nebraska people. If it's a law enforcement issue, they'll be put in contact with the State Patrol, and there's several agencies that will get the email about this. If they're a victim or they're calling on behalf of a victim and they don't want to talk to law enforcement, but they want to talk to a counselor, then they would be put in contact with a person in Nebraska that's professional to do that.
Is there anything else you want to make sure that our viewers are left with thinking about?
I would love just to re-emphasize that this is not something that we're tolerating in Nebraska, and especially the demand side. I think that's something that everybody can spread the word about, that this is, we're looking for it. This is not something that we're okay with, and we want to discourage people, but those who actually seek out minors for sex will be prosecuted. So, thanks.
Thank you so much for the work you're doing.
Yeah, thank you, Melissa, I appreciate it.
Good day and welcome to Shape of the City. Osteoporosis is a major health concern for postmenopausal women. Currently, the University of Nebraska Medical Center is undergoing a study trying to determine better ways to prevent osteoporosis. Today we're here with Dr. Laura Billick that will tell us more about the study. How are you today, doctor?
Great. Nice to be here.
Could you tell us more about this study by UNMC, which, if I am correct, is the Heartland Osteoporosis Prevention Study?
Yes. As you mentioned, we're looking at ways to prevent bone loss in early postmenopausal women, and we're comparing different interventions that we know have a positive effect on bone. So we're comparing the effect of just taking calcium and vitamin D supplements to the effect of taking these supplements plus exercise, or taking these supplements plus a medication which is known to prevent bone loss. And we're looking at how each of these interventions keeps our bones healthy.
Why is a study like this one so crucial?
Well, osteoporosis results in fractures later in life, but the problem starts earlier. And actually, 50% of women will have a major fracture at some point in their life. And for women who have hip fractures later in life, 20% will end up dying within a year. So the problem is, many people have fractures later in life and die from a fracture. We don't often think about that, but we have to treat the problem much earlier to prevent major fractures later in life.
How long has this study been going?
About 3.5 years. We have another 1.5 years left. We're recruiting women to enroll in the study for approximately 6 more months.
And what's the end objective once the term is done with the study?
Well, the women who enroll in this study participate in the interventions I mentioned for 1 year, and then we look at their bone health after 1 year in the study. Take all that data, analyze it, and see which of the interventions might be preferable over the other. Publish all this data, and based on that, see what the next study might be. We have some early results that suggest exercise may have a very specific effect on a certain type of bone, and it might be independent of bone density. So we're already looking at how we might explore that more fully.
One of the biggest things, especially nowadays, is confidentiality. What's going to happen with the information that they give to you?
Well, we treat all information confidentially, just as their doctor's office would.
What are the criteria that you're looking for to select participants?
Well, again, we're looking at women in the first few years of menopause, so it has to be within 6 years of a woman's last menstrual cycle. And they have to not be on any medications that affect bones, like estrogen replacement or hormone replacement therapy or other medications, and generally healthy. So if they call us, they can find out more to see if they qualify, or if they go online, they can take a screening test and find out independently. Then if they qualify based on those characteristics, they come for a screening visit where they have a DEXA scan at no cost to see what their bone health looks like or their bone density. To be enrolled in the study for the year-long portion, they have to have early bone loss or osteopenia, meaning kind of the precursor to osteoporosis.
What's the level of dedication that you're looking for in the participants? Like if somebody were to ask, what's the investment of time for the week, for example?
Well, it depends on which group they're randomized to. Everyone is given calcium and vitamin D at no cost to take every day, and boy, our women are very good at taking their supplements daily. If you're randomized to the medication group, you take a medication that prevents bone loss once a month. We send that to you, it arrives in your mail, it's at no cost. If you're in the exercise group, we have you pick your location to exercise at your convenience, a YMCA either located in Omaha or Lincoln, and we prescribe exercise 3 times a week. We understand there's life, there's no consequences if you don't make it to the exercise, but we have a prescribed exercise program for a year-long period of time.
What have you heard from the participants? What kind of feedback?
The knowledge about the disease process and how to manage it is very important. And also, there is no limitation on independent exercise during the study. We don't try to limit anybody's lifestyle while they're in the study. So I think most people appreciate that the study doesn't inhibit them from doing what they want to do, and that they are then contributing to a way to help solve this problem of how do we prevent fractures that could lead to death later in life.
Thank you very much. Exercise researcher for the Heartland Osteoporosis Prevention Study through the University of Nebraska Medical Center. Thank
Great.
you for being with us and have a great day.
Thank you very much. I appreciate it.
Today we're here with Andrea Holka. Andrea is a participant of the Heartland Osteoporosis Prevention Study. How are you doing today, Andrea?
I'm great. Thanks, Roy.
Well, thank you for joining us today and letting us know more about this study. Could you tell us how and why you decided to join this study?
I can. So last February, I went to the doctor and I had a bone density test, and it showed that I had osteopenia. And then several weeks later, I randomly got a postcard in the mail regarding the Heartland Osteoporosis Prevention Study, and I was really intrigued because it was right up my alley. And so I did the pre-screening online, and it showed that I should qualify, and so I contacted them and set up an appointment, and they did the testing, and so here I am.
Could you tell us why you feel that this study, participating in this study, has been important to you?
It's been really important to me. I take 2 supplements, which is part of the trial, and then I also exercise 2 to 3 times a week. With this arm, I'm in the exercise arm of the study. And with the calcium and the vitamin D that I take, my bone density has improved, actually, a very small percentage, but that's cool. And then the vitamin D has been really important to me because previous to that, at least 2 years previous to that, my vitamin D was so low. And so with this study and them working with me with my very low vitamin D, I've been able to actually sustain and maintain a very healthy level of vitamin D. And so I feel much better.
What are other benefits that you have received from participating in the study?
So as an exercise participant, obviously the exercise has been extremely beneficial, and then taking the vitamin D and the calcium is also really important for women for bone density. And you get education and resources when you sign up for the trial that help you understand why you're doing what you're doing.
Did you have any hesitations and any perceived benefits that you had in your mind when you were actually entering your information?
So when I got the postcard in the mail, it was a UNMC clinical trial, and of course UNMC is located in Omaha. So I did wonder, how that would look if I were a participant from Lincoln. And fortunately, they work with the YMCA down in Lincoln. They work with both the Northeast Y and the Cooper Y. So those are the 2 locations that if you're an exercise participant, you can go and exercise there. But even if you're in the other 2 arms of the trial, it really only involves 2 or 3 trips up to Omaha. And there is actually some compensation for that included in the trial. So it's really not, that really shouldn't be a barrier.
Perfect. Thank you very much for the information and sharing with us. And, congratulations on the results.
Thank you.
Thank you for joining us today.
It doesn't hurt to make a phone call to find out if you qualify and to find out more about the study. There's really no commitment to reaching out to find out more.
What if you could add 5 years to your child's life and make your whole family healthier with simple changes? Partnership for a Healthy Lincoln wants you and your family to live longer, healthier lives. It's easier than you think. Walk the dog every day, play more, and text a little less. Swap out a sugary soda or energy drink for water once a day. Keep fruits and veggies handy for snacking. These simple changes can add 5 years to your child's life and make your whole family healthier. Learn more at healthylincoln.org.
Hello, I'm Tim Timmons with the Lincoln Lancaster County Health Department, Communicable Disease Program Supervisor, and I'm here to talk about flu with you. It's currently coming into the end of January, beginning of February, and flu activity in Lincoln and Lancaster County is very high at this point in time. We're seeing a lot of individuals coming down with flu in the state, and also locally we've had some deaths due to flu this season. The current influenza virus that's circulating is primarily an H3N2, which tends to cause more severe illness in individuals who get infected with the virus. There are other types of strains of influenza that's circulating. The other major one is a type B influenza. Our primary means of prevention in terms of reducing your risk from influenza is getting vaccinated. It's never too late to get vaccinated against the flu. Vaccination will reduce your risk. It may not be 100% and eliminate your risk completely, but it'll reduce your risk of getting severe infection or developing complications from the flu. Individuals who are at high risk for complications, we really encourage you, if you have not already been vaccinated, to do so. You can't get influenza from the vaccine. The vaccine uses a killed virus. It can't give you the flu. The other thing people think is that they have the flu, and when we ask them what symptoms that you've had, they'll say vomiting or diarrhea. Now, what they're referring to is a lot of times called stomach flu, which really isn't the flu we're talking about. The immunization, flu immunization will not protect you against stomach flu. That's a whole different thing than the influenza we're talking about, which is respiratory. And it is respiratory, and sometimes it can be confused with having a cold. But there's a difference. With colds, they tend to come on gradually. You may get a stuffy nose, head cold, what we call a head cold, sore throat, and then eventually it goes into the chest and you develop a cough. And a lot of times it's a productive cough. When you cough, you bring up mucus. That's a cold. With influenza tends to be sudden onset. You may feel fine, go to work, and be doing fine, and then by mid-morning or afternoon, all of a sudden you feel like you've been hit by a Mack truck. Your chills, achiness, fever. Usually fever is going to be a high fever, but it can be sometimes low grade. And just fatigue. Eventually a cough will develop, but the cough is a non-productive cough. You won't be bringing up anything when you cough. It'll be a non-productive cough. And again, symptoms may last 3, 5, maybe 7 days for some individuals. Individuals should not go back to work, to school, or to childcare until they've been fever-free, not on any fever-reducing medications, for at least 24 hours. That way, once they go back, they're no longer at risk for transmitting to other individuals. Other things individuals can do related to flu is wash your hands frequently during the flu season, cover your mouth when you cough, in your sleeve, your nose when you sneeze. If you do develop symptoms of influenza, stay home. Avoid being around individuals who are at high risk for complications due to the flu. Those individuals who live in the same household as an infant under 6 months of age that can't be vaccinated need to be vaccinated. We really encourage you to be vaccinated. And individuals who care for infants should be vaccinated. Because what you're doing is, because you can't vaccinate that infant under 6 months of age, you're doing what we call cocooning around it. You're protecting that infant by making sure those who are around that infant on a daily basis are protected and reduce their risk of getting it and then giving it to that infant. And again, child care providers who have infants in their care, the importance of being vaccinated as well. It's important to reduce, particularly very young children, 2 and under, exposure to flu. So don't be taking them, our recommendation would be avoiding going out into crowds, to malls and stuff where there's lots of people when there's a lot of flu going on in the community, to reduce their risk of getting exposure. And that can be true for other older individuals, other people at risk. So the important thing is to take measures to protect yourself, and the primary means of prevention is immunizations, and it's never too late to be immunized for flu. And take those other precautions in terms of hand washing, covering your mouth when you cough, your nose when you sneeze. And then remember, if you get symptoms of flu, if you're at high risk, contact your healthcare provider and maybe get on an antiviral medication to reduce your risk for complications and the severity of the illness. If you're a healthy individual, stay home, stay down, take care of yourself, avoid being around individuals who are at high risk for complications due to the flu. And once you're fever-free for 24 hours off fever-reducing medication, you can go back to your normal activities. You're not at risk for transmitting to other individuals.
Shape of the City is dedicated to keeping Lincoln informed of health and wellness programs and events. Visit our calendar at lincoln.ne.gov, keyword Wellness Calendar. If you'd like to see your program or event covered, email us at lnktvhealth@lincoln.ne.gov.
Thank you for watching. Until next time, get active, eat healthy, stay informed.